just welcome everybody and thank you for joining today's webinar where we're going to discuss substance use recovery and hope with three panelists who were involved with the documentary called The Addict's Wake. The virtual screening of the film started on September 19th and it ended today. So I hope many of you were able to register and watch the film. And it was brought to you with funding from the network of the National Library of Medicine, Region 6, which is located at the University of Iowa. Now, I'm Darlene Caskey. I'm the Associate Director for Region 6. And joining me is Miles Dietz-Castell, who is working on our slides at the present moment. And please know that we're also recording today's program, and we have a live captioner available. And we will be monitoring the chat box. So as you think of it and have questions, please put those questions in the chat box, and we will try to address them with our guests. So now, if you are participating for the first time with us, allow me to introduce our organization. The Network of the National Library of Medicine, or NNLM for short, is an education outreach program of the National Library of Medicine. The network is comprised of 7 academic medical libraries across the United States. The National Library of Medicine, or NLM, is the largest biomedical library in the world, and it's also one of the 27 National Institutes of Health, or NIH. Now, NIH is the nation's leading medical research agency, and it's under the umbrella of the Department of Health and Human Services. Its mission is to make important scientific discoveries, to advance the progress of medicine, and to improve health for everyone. Now, our outreach efforts of NNLM assure that researchers, health professionals, the public health workforce, and the public are made aware of and have access to biomedical information and health information resources and data. And why is this? This is because we want everyone to have good information to make informed decisions about their health. Now, how do we accomplish our mission? Well, one way is by offering free continuing education courses and specializations for health professionals using a variety of live, asynchronous, and on-demand learning platforms. You can learn more about our courses by visiting nnlm.gov/training. And then another way that we help communities is by providing funding to help start projects and programs for health information. For example, on our website, you'll discover a collection of media slides in multiple languages for substance use and mental health information. They're available to download and use for free. These slides were developed in collaboration with TNT Now. They're a public broadcasting station in St. Paul, Minnesota. And additionally, the NNLM staff develop ready-to-use programs, such as the NNLM Reading Club. That program has a selection of substance use book titles as well as discussion guides. So now, I would like to introduce our special guests so we can talk about the film and the topic of substance use disorder. We're very happy and pleased to have joining us the film's executive producer, as well as 2 physicians who have significant experience with substance use disorders. Lisa Hall is the executive producer and producer of The Addict's Wake. She's a graduate of the Indiana University Kelley School of Business and a marketer of products, ideas, and business initiatives. She also has extensive experience in nonprofit leadership and fundraising, and is a recipient of the Distinguished Hoosier Award by Governor Eric J. Holcomb. And she was also presented with the Recovery Ally of the Year Award in 2022 by Recover Out Loud. Well, congratulations, Lisa, on all those awards. They're very well deserved. And thank you, most of all, for making your film available to us. So I want to ask you, as an idea generator, how did you conceive of this documentary, and did you have any experience with filmmaking prior?
No, I did not. The short is no. And thank you, Darlene, for having all of us on today and for being an advocate for the messaging of this film. And I very I'm as surprised as you are that I made a film. I am a marketing girl. I've been a marketing girl since I was about 10. My husband and I moved to Brown County in 2017. And for those of you who don't know much about Indiana, Brown County, Indiana is our own little very personal Hallmark community. And it looks like it came straight off the set of a Hallmark Christmas movie. And what I didn't know then is how sick and addicted our underbelly was. And I started serving our women in incarceration, and I started hearing their stories. And two things very quickly occurred to me. One is that they're very little different than I am. They were women with dreams and families and homes and careers and goals. And because in a vulnerable moment, they decided to use one of today's highly addictive drugs, they're sitting in green and white stripes. And boy, don't you know, the first time I left there, I thought, you know what, I could be sitting in green and white stripes had I had made that choice in a dark moment in my own life. And then two, as I started thinking about their stories, I thought we've got to do better. We've got to figure out ways to be restorative for people sitting in incarceration where it is the offense is drug use, pandemic drug use. And it is pandemic today. It is something that is robbing us of so much human potential and so many lives, young and old alike. And so I had an invitation to tell stories, and I said yes. I had really very little idea of what I was saying yes to, but I was passionate enough to want to make a change the trajectory of the direction we were going with mental health and addiction. And so I said yes, and that's where it started with the yes, let's do something. Let's tell some stories.
Wonderful. And we're glad you did. So thank you. And we'll talk about your film more as we go along.
Yeah, thank
I'd
you.
like to introduce our other guest, who is Dr. Lynn Whitty. She is a retired pulmonary critical care physician. She earned her medical degree from Indiana University School of Medicine and her specialty training at Duke University Medical Center. And it was during her career, she practiced medicine at a large community hospital in Muncie, Indiana, and was an associate director for the internal medicine residency program for many years. Currently, she's serving as an adjunct clinical assistant professor at the Indiana University School of Medicine in Muncie, and she focuses on community-based research projects on health behaviors and outcomes. So, Dr. Whitty, thank you for being with us. I understand that you were very instrumental in the community programming outreach of the educational version of this full-length film, which our members were had the opportunity to watch for the last week. Can you tell me more about that outreach?
Yeah. So I actually became very interested. I almost have two lives. I have one that was in the hospital, and then I got very sick. And when I came out of being homebound for a while, I started to work in the community, and I had never really left the hospital. And so I really saw what our community was like, which I know was something that Lisa really had seen. And our county commissioner said, "You have to go see this film." And she had seen Attic Wake and sent me down. I went down to Bloomington and met Lisa and saw the film, the original film, and where it won Best Indiana Film. So Lisa said, we're doing another film, and I had just finished working with the Muncie Community Schools on a restorative vaping program in the schools instead of suspension. So I went to our superintendents after Lisa and I spent a tremendous amount of time deciding that this guidebook was the perfect thing for teachers. And so what this film really consists actually goes through each segment and gives statistics, but also reflective questions for the teacher to ask the students, have discussion class. this is a novel concept. I love that concept because kids don't have the capacity to talk about something this deep and can be very emotional. And so I think sure, I'm going to try and stop my video. I think you guys are having trouble hearing me, maybe.
Yeah, there's a little breakup. So
So I actually go ahead.
oh, I was just going to thank you for
Is
doing that.
that a little bit better, hopefully?
Yes. So my understanding, maybe to fill in, maybe what I think I heard through some of the static, is that you were instrumental in creating or disseminating the discussion guide that goes along with the film, and you were working with high school students in Muncie. Is that correct?
Yes, yes. So hopefully you can hear me a little better now. So it's divided into 9 segments along with the movie, and each segment has a whole host of information for a teacher as well as questions to ask the students that they can have a discussion. So the teacher doesn't have to be, an expert at addiction, but they do just need to be able to listen and to read through the book. So um, when I found the right health teacher at Muncie Community Schools, she was so excited to do this program. She took it into 6 of her health classes, and with the support of the superintendent and the school board, we started this, and almost 100 students saw it, took a pre-test and a post-test, which we felt was very important to gather data. And it's kind of, if you see this film, and we really want that data to see what in different ways for the kids. So huge success with that. But the first step I sent Lisa, she's like, oh my gosh, that could be like 5 books. So it's now very easy to work with. And
That's good to hear, and thank you. And my understanding is it doesn't just have to be for educators or schools. The book could be used with any kind of community organization.
I actually have a bar
absolutely.
association in New York, Darlene, who's going to use it to educate their lawyers.
See, very good. Well, I want to make sure that is known
Yeah.
to our members that are attending today. Well, let me move on and introduce our third participant today, and this is Dr. William Cook. Now, you may recognize him from the film. He is the founder and the medical director for Foundations Family Medicine, which is now a division of Well Care Community Health Centers located in Southern Indiana. He graduated with honors from the IU School of Medicine and is a fellow of the American Academy of Family Medicine and the American Society of Addiction Medicine. His national recognition includes being the Physician of the Year for the American Academy of Family Physicians, Doc Hollywood by the Indiana Rural Health Association, the Ryan White Distinguished Leadership Award, and the IU Bicentennial Medallion. These awards are well deserved as well, Dr. Cook. One other distinction that you have is author. You wrote a book called Canary in the Coal Mine. Will you tell us a little bit more about that? Good.
Thank you for that kind introduction. I appreciate that. And yeah, I named the book Canary in the Coal Mine because just like coal miners brought canaries down into the coal mines with them to warn them of toxic conditions so they could do something about it before it was too late. Uh, I've noticed that there are toxic conditions in our communities that are harming people. And in 2015, Scott County, Indiana was the epicenter of the worst drug-fueled HIV outbreak in US history. But it wasn't all by itself an HIV outbreak. It came out of decades of toxic conditions that existed in the lives of people who had migrated out of Appalachia. And these conditions are directly related to what's referred to as the social determinants of health. And we know that when people don't have access to those social determinants of health, and they are instead exposed to poverty, um, unemployment, inhumane housing or unstable housing, and generations of mental illness and substance use disorder, that those children born into those conditions, they don't do well. And it shouldn't be a surprise to know that places like Scott County are at risk of these overwhelming, devastating epidemics. HIV is one, hepatitis C is another. Indiana leads the nation in hepatitis C cases. And then, of course, substance use disorder and overdose deaths.
Thank you. Your book is very compelling, and we do feature it as part of the NNLM Reading Club. If you come to our website, you will find his book, and it has a discussion guide. So thank you. I will now share a slide, or Miles will share a slide to get our conversation started more fully. All three of you are from Indiana, so I'm sharing some statistics from Indiana. This comes from the CDC, and it shows the rates and how they were climbing, especially during COVID, which was just spiked in overdose deaths. There were 2,206 opioid overdose deaths in Indiana that accounted for 78% of all drug overdose deaths in the state at that time. So addiction is one of the largest problems Indiana faces. However, there's some good news. Just this weekend, NPR came out with a special report on that the numbers were declining. The NPR exclusive report, and it said the numbers are coming down. And the national surveys compiled by the Centers for Disease Control and Prevention, CDC, show a decline in drug deaths of roughly 10.6%. However, health workers and law enforcement are voicing caution. In the article, one official was quoted as saying, "The last thing we want to do is spike the ball." So, from your lived experiences and your work, do you think we need to be optimistic or cautious about this kind of information that's coming out?
Well, I'll go first, and then I know probably Dr. Cook will want to chime in. I say we have to be really cautious about those statistics, and for people like Dr. Lynn and Dr. Cook who are treating this on a daily basis, I know they're going to say the same. Fatal overdose deaths are down, and that is a wonderful thing. But that is because we have naloxone now widely distributed throughout the state of Indiana. And that is no small feat. That is a great thing that we've equipped our communities with, being able to resuscitate folks in an overdose situation. However, overdoses are not down. And in fact, that's the opposite. It's up. And so I get very frustrated as someone who is trying to move the needle forward on this issue, that we have statistics coming out saying we're winning. We are doing good work. We're improving. We're saving lives, but we're not winning this battle yet. And overdoses, as I said, are in fact up. And so I think we have to look at statistics very cautiously. I know the government is wanting to put out hopeful things in this issue because it has affected this entire nation, but I would be cautious as you hear those kinds of statistics.
Yeah, I think there's reason to be both optimistic and cautious. Is it good that fewer people are dying from fatal overdoses? Of course, absolutely. And if you dig down into it to understand why that's occurring, it starts to make a little bit more sense of what's happened in the communities that have been affected. And one of the most significant things that's happened within these communities are community distributed Narcan. And we know that when somebody overdoses, they can be resuscitated by Narcan. And we don't always know how many people have been resuscitated by Narcan because it is distributed within the community. Now, as a physician, I don't distinguish substance use disorder from any other condition like heart disease. If you look at heart disease, we have fewer people dying of sudden cardiac deaths. In the community, we now have people who are trained to do CPR, and we have AEDs, automated external defibrillators. And we know that where AEDs are placed, the risk of death related to sudden cardiac death can be decreased by half. In some settings, like in health clubs, it can go from a 7% chance of survival all the way to a 93% chance of survival. Are there fewer people experiencing heart disease? No. Are there fewer people experiencing the causes of sudden cardiac death? Probably not. But fewer people are dying because we have interventions in the community. And that's what we're seeing with overdose deaths is we have more interventions in the community with fewer people dying, but we still have the same conditions in those communities that have been causing the suffering and the conditions that yield substance use disorder and people turning to these drugs and alcohol as well.
Yes, I know that in some of your presentations you've talked about alcohol being a higher fatal form of a drug than even the opioids and the fentanyl and the synthetic drugs.
Right.
It certainly
Yeah,
is.
more.
And I know, oh, sorry. I was just going to say, one of the things that we've really seen is, and we actually, speaking of my students' research projects, looked at the distance from our Narcan boxes to the number of phone calls that are made to EMS. Because people, if they get resuscitated by a family member or somebody resuscitates them and with Narcan and they can walk away, they will walk away instead of staying and waiting for EMS. So those don't even a lot of times get reported. If you count the boxes in a Narcan box or in a box that holds a lot of Narcan, it's being used, but we're not actually getting reports of all the people that are using it and walking away because they don't want to, they'll get to the ED by ambulance if they know they're coming, and the ED will say bye most of the time when the patient doesn't want anything done. So yeah, even the reporting is documented difficult when you do that.
That's a good point you bring up, and it leads me to something that just came out today. In fact, from NIH, we have an online newsletter called Medline Plus and magazine, and perhaps Miles can share that link in the chat because it talks about stigma. And in this article, it says that many in 2023, an estimated 16% of people with substance use disorder reported that they did not seek treatment because they worried about what their community would think. So I'd like us now to talk a little bit more about stigma and how that affects getting harm reduction into communities, recovery centers into the communities. Just talk a little bit more about stigma and how we can address that.
Well, I'll start with the feature length film, which you all saw the educational film, it came as a result of an outcry as we were in community showing the film that we originally premiered with. And it's an hour and 45-minute film about Brown County and as a community, what we were doing to push back. But as my director and I sat down to talk about storyline as we were garnering footage, we had 4 goals that we wanted in the original film, the PBS version, the educational version, and soon to come our law enforcement piece. And those 4 goals have not changed. And one was creating a broader swath of emotional awareness. And why do we want that? Because when we shed light on issues, then it starts to bring it out of the darkness and it can be dealt with. So as we've been screening in communities, the biggest thing that I've seen happen is the stigma begins to melt away. And so the second goal was to reduce shame and stigma. And it was doing that as we have screened inside communities. The third goal is to really encourage communities to fight back at a grassroots level, because I've had 2 state senators say to me, this has to be grassroots for our communities to get whole and heal. And then, so we've got to quit working as silos, open our arms, link arms, and figure out how we can fight back at a grassroots level with all the stakeholders in the community being invested in some way. And then lastly was to create a film that did show recovery does happen for folks. And there are folks that are going on to live amazing lives, doing incredible work in the space, then turning their pain into purpose to help others. And so those 4 goals have been maintained throughout every film, even the educational version they saw. So I think when we can start talking about it in our classroom, start talking about it, bringing people together in our libraries, that's the first step to destigmatizing this issue. And one of the things that we heard about that feature-length film is that people said, wow, this really humanized it for me. And I thought, okay, that's a win. Now we're starting to see people as fellow humans. We're breeding compassion as we have these conversations. We're breaking down that they, us kind of, determinant. And so, I can say that the film started to do that as we got into communities in late 22. And I'll let the others kind of talk about the ways they see that happening with stigma.
Yeah, I mean, just the bottom line is people need to know where to go when they're not okay. And if you don't know that it's safe to seek care somewhere because you're afraid you're going to be stigmatized, cast away, or even arrested, you're not going to seek care. And it's when people are not doing well that they're at the most risk of dying. We know that, through research, no matter what the condition is, loneliness kills. And in the region of suffering and substance use disorder, when somebody's alone, they're more likely to take their life and they're more likely to overdose and die. And so it's up to us to really make sure that people know that it's okay to not be okay. We all struggle, and where to turn when you are struggling, when you're not okay, that it's safe to come see me at my clinic. And, we're going to take care of you and do everything we can to wrap care around you and connect you to resources. Because it's in that person's having the worst day of their life. If they don't know where to go, they're at a huge risk of dying.
Yeah.
And I think that communities, in general, don't realize how similar we are. Again, you talked about silos, but and I always, my 2 favorite words are education and communication. And it's just like you said, if they know where to go, if they understand they're not alone. But getting over that stigma issue means that people actually have to work at it. And we had a political forum last night, and it's very interesting because one of the persons running for county council said it was really brought to his attention when he and his wife happened on this film called The Addict's Wake, and they watched it. They were having a really difficult time. They watched it, and he's like, there wasn't a dry eye, and it did exactly what you said, Lisa. It made it humanizing, and they get the part that these are people that don't want to be. I mean, you don't wake up one day and go, gee, I want to be an addict. I mean, that's never a choice, but it's biologic changes that happen, and particularly in juveniles. And this is one of the things we bring up with, kids, even nicotine, but you get into harder drugs, your brain doesn't stop changing and growing until at least 25. I think it's probably continual, but that takes a long time to reverse. And yes, there can be reversal in these symptoms, but addiction means help. I think people need to know where to get help, but they need to also understand that they're not alone. I think the other key important thing is that people who stigmatize or look on substance use abusers, they can get better. There are peers that are doing amazing things right now that have gotten through it. It may have taken them 20 times, to try and quit. But they are doing amazing things. And I've never met people that are more interested and enthusiastic about helping others and working hard and knowing that they're so lucky to be here. If you want to hire somebody, hire a felon who's gone through an addiction program, and they will work so hard. We have a program here, it's called a jump program, where they place felons who have been through training or whatever, and they want to make it. So, and when people outside of the addiction community can see that and experience the joy that when you feel and you get through recovery, I think it would be a different understanding. And your films show that. And I think that's one of the need to see these films is it shows that the hope is not just something where one person makes it out of all the persons. They not only make it, but they go and they're productive and they help others. I mean, they really help others. So I think those are important things. And then you can just go, wow, this person, and yeah, it took them 2 times, 10 times, 20 times, but nonetheless, they're glad to be alive. And no matter what difficult circumstances they have, and if you listen to some of them, I'm amazed at what they've been through. Just amazed. But
Lots of resiliency in the human spirit, isn't there?
It's amazing. So yeah.
Something you said about how the brain actually grows pathways after somebody has been using a substance for a period of time. It starts with a choice, of course, but if experimenting with a substance always led to addiction, how many people that's even joining us or in any college campus or what have you, would end up going on to addiction? There's something else there, whether it's genetics or adverse childhood experiences, those toxic stresses that people grow up under. But once someone has been using for a period of time, there's actually cellular growth that builds networks that is like a reflex. When you hit your knee, your leg jumps. Very similar. Our environment cues our behavior. So we talk about people, places, and things. At some point, the brain has been hardwired to associate those people, places, and things with this substance that makes them feel safe, meets their needs in a way that the brain is fooling them into believing that. So it takes some time for that cellular growth to reverse. You can imagine actual physical cells growing and having connections. That doesn't happen overnight. So we wonder why people, go into a 28-day program, have no follow-up, and they go right back to their old ways. It's because that cellular growth hasn't had time to reestablish in a different way. We got to have an ongoing, lifelong, connection with other people. And as far as people that come out of addiction into the recovery community, I've found that, that they have found their purpose and meaning. And if you've ever been around somebody that's found their purpose and meaning, it's contagious. It's just such an energy that's emanating from somebody in that state. And the people in the recovery community, they found their purpose and meaning, and there's no way to not be around them and feel just enthused and excited and inspired.
Can you talk, building on that, tell us more about, there might be people here that really don't understand peer recovery programs. They may not understand what harm reduction is. So just stepping back a little bit and filling in those blanks. Like the needle exchange program, that's harm reduction, right?
No one better to speak about that than Dr. Cook, because he single-handedly reversed with the team, but the outbreak, the HIV outbreak that was historical for Scott County, he got in there and did the work. So I want you to tell him all what you did.
There was a whole bunch of people.
I know, but you were leading the way. This is not the time to be modest.
So yeah, as a physician, my job is to reduce the risk of someone suffering a bad outcome. And again, I don't segment, you know, alcohol over here and tobacco over here and diabetes over there and heart disease back here, accidents in another. I mean, they're all the same, you know? So when I see a kid, you know, I'm talking to them about wearing their seatbelt and putting a helmet on when they're going for a bike ride and make sure that mom knows how to get a hold of poison control. I mean, that's harm reduction right there. Having AED devices in our gyms to reduce the risk of sudden cardiac death from, you know, survival being 7% all the way up to 93%. Having that AED device in the gym is harm reduction. Teaching my diabetics how to eat a low carb diet and exercise and actually do resistance training so they build muscle so their metabolism speeds up. That's a form of harm reduction. So in the space of substance use disorder, we know that people who inject drugs are at risk of contracting viruses like hepatitis C and HIV. They're at risk of developing abscesses, infections that can go to their heart, their lungs, develop into sepsis, spinal infections. These things happen. Now, my goal is obviously to try to get them from injecting drugs into recovery. But in the meantime, I have to keep them alive, right? And so, in order to do that, we have to teach them how to practice harm reduction in that space. And so if somebody's injecting with a syringe that's not sterile, it's got bacteria in it that they're injecting directly into their bloodstream. I mean, you can imagine that's going to their heart, their brain, their spine, causing, again, sepsis. Or if they're sharing syringes, someone who has HIV could infect someone who doesn't through that sharing. And so by providing sterile syringes, we're not, you know, encouraging them to use drugs. We're decreasing their risk of contracting an infection or dying. And I say it doesn't increase their risk of using drugs because we know with diabetics, insulin-dependent diabetics who have access to syringes, if you compare that to the general public, the incidence of injection drug use is the same. It's not higher just because they have access to syringes. It's the same. But what is different is the rate of HIV and hepatitis C in that population compared to the regular population of people who inject drugs. It's much, much lower. So syringes don't cause people to use drugs more, but it does decrease the risk of HIV, hepatitis C, and death.
Yeah. And that's definitely something that people do not talk about and don't know anything about. Our rates here in Delaware County are not good. But we, you know, I always thought if you educated people that they would understand. So you have to, we go back to the stigma where people exactly think what you said. If you give them, you know, clean needles, they're going to want to use more. And that's not the case. And so that is one of the things. Fentanyl test strips, you know, they save lives because you're testing for fentanyl. It doesn't make them use more, but you know, saying you're going to prosecute people because they use fentanyl test strips is not accurate to what we know. It detects presence. It doesn't detect purity, which in our Indiana legislation, we've had trouble with this. And it's a harm reduction to use fentanyl test strips, but it didn't pass our Senate. So again, I think that's educational, that it has to be known that it can keep people from dying. And it shouldn't be illegal to use it. Even I know here in Delaware County, we've been told even being a medical person, we could be charged using those because it's considered drug paraphernalia. So again, that goes back to understanding who we're dealing with and who's making the decisions. And I'll tell you from our forum last night, a lot of the people in the legislature making these decisions will say, I don't know that much about it. And they're, you know, your hope is they'll learn and they will communicate amongst each other. That was kind of my whole purpose of that, is so they could see that There are so many issues and they're making decisions, but do they really know what's best or what's accurate? Evidence-based, as physicians, we love the words evidence-based, but that's because it tells the truth. It's not someone's opinion. We have data, and that's, what we need to have legislators and politicians making decisions for us. They need to understand what's accurate. Board of Health is another one. They have to understand that. And then it trickles down, because if someone tells them, who's in a position of authority, that no, you shouldn't have a safe syringe program. Where did that come from? So let's pass on accurate knowledge. Exactly what you said. Reduce Hep C and HIV. We're spending so much money as a nation on that, when there are ways that we can combat it. But a lot of people with HIV and Hep C don't even get tested and don't know they have it. They should be screened. We have some screening programs, but there are a lot of people that don't know. So, hopefully the community has a screening program as well.
Yeah, and
Dr.
people that contract HIV and hepatitis C, this is a very expensive consequence to the entire states, the entire country, and it's preventable by making sterile syringes available to someone. That's giving them the option to make a healthy choice. I always hear, well, they should make better choices. Well, sometimes we need to give them the better choices to make, because people can only make choices from options that are available to them. Again, people don't know where to turn to get help. Every doctor's office isn't safe. And what do? Go into a police go into a police station and say, hey, I'm here using drugs. I need help. Go to where do you go? Where do you go for help? If you have a syringe service program in the community, there's no question where to go. We know that, somebody that's injecting drugs know that that's a safe place to go for help. So providing that access point where they can connect with doctors like me and healthcare providers, people in recovery that can help them take those next steps that they want to take. They're just not knowing how to get to that place. That's giving them access to something that they didn't have before. Without that access point, they don't have the choice, because they can only make a choice if the option's available to them. So it's our responsibility to make sure that we have these places where people can turn to for help, because otherwise, if they're left alone to die, whose fault is that?
And when you say our responsibility,
I just want to add really quickly to that, Darlene, and Dr. Cook has taught me so much, and so has Dr. Lynn, but just about the importance of medically assisted treatment. And so we made the law enforcement version with the idea to help educate some of our first responders and law enforcement folks on what they can be doing with someone while they're in incarceration. And that can be stabilizing them. And again, Dr. Cook is such a proponent of this medically assisted treatment. And I didn't understand it until I listened to him on a number of times talking about it. And I really wanted that messaging to get out, because we want to take advantage of that time we have with people when they're drying out, they're detoxing, and we want to stabilize them and minimize cravings, again, for their health, their mental health, their well-being, keeping them alive. And then when they come out, because they're more stable, they can re-enter into society in healthier ways. And they don't have to make that first call to their drug dealer. And that's what was happening until, we kind of got onto this MAT concept. And so we have some people successfully implementing that in incarceration in the state of Indiana, but we have a lot more work to do here and certainly outside in other states. So we want to show that messaging as well. And that goes along with the harm reduction.
And I just to add on that, we were lucky enough to be one of 5 pilot programs for something called IRACS, Integrated Recovery and Correctional Support. And these are some of the heroes in my mind. So peer recovery coaches, actually, their job is in the jail and it's voluntary for inmates, but we've had, I think, up to 95% now or it may even be higher. And these peer recovery coaches work with the inmates in the jail. You can go through drug treatment programs while you're in jail as well. You can choose to do that. But the peer recovery coaches, they know what they're going through. They go through this, and when the inmates are ready for release, we actually have a peer recovery group on the outside that follows them for 30 days, helps them find a job, get to meetings, get their driver's license. And this program, it's a state-sponsored program. After the first year, I'll tell you that jail, they said we can't function without this. The peers go to court and even with the inmates, and it's an amazing program. And so I think it's just really one of the things that helps. And I do want to just say, because it's so dear to my heart, looking at the juveniles and the youth in our community is something with this film is so important. And I can tell you the health teacher that we used in the high school said she can't imagine ever teaching a health class without the ability to show this film. They spent 4 days with this film, having discussions, talking about things that they never would have talked about. And so it's something that once you see it, and I said this earlier, it doesn't ever go away. I mean, it's with you. And for kids to see that and discuss that, I mean, this should be in every school. And if schools say they don't have a problem, then they need to reevaluate who's assessing that, because I guarantee that that's not the case. And it's different in our county. Every school has a different drug. It's a different drug that's being used, but it goes back to trauma and what to do about family trauma, and having those discussions, and having kids know it's okay to come and talk to somebody. A lot of times, I'll tell you, they won't go to the counselor because they're afraid that CPS is going to be called. I'll just tell you that. But having them know somewhere they can go where they're not at risk for getting in trouble is really important. So I think, I just have to plug this film again, because between that and the guidebook, it is unique, it is amazing, and it really will change lives of youth and families. I think it ought to be shown to families, and a big discussion group for families. But so I just wanted to throw in those two things, because those two things I think have been a huge help to us as well. Again, goes back to education and communication. Again, no silos. We need to know what's there, and thank Dr. Cook for saying that. It doesn't help if people don't know where to get the help that's there, or if it's not there, how do we develop that help? And that's me out on the street. I was out on the street during COVID, talking to people where they are comfortable to talk. And that's where I take my medical students too. So, but I just really wanted to plug that.
Real quickly, that they mentioned coming out of jail. We know that those first 2 weeks of being released from jail, people are at a dramatically increased risk of dying during that period of time. But if we connect them to peer support specialists, so that the first person they see when they come out of jail is somebody in recovery that cares about them and is going to walk that journey alongside them, instead of who their people, places, and things that they associated with using drugs, they're more likely to be stable and not turn to that. And it's not just people that are released from jail, it's people that are coming home from the military, even, when they come back to the community, are we waiting with open arms? Or is it a friendly, welcoming community that helps people transition back into community with access to housing and jobs and community? Or is it a closed off community where people come back from the military, they don't know where to turn, they experience that loneliness? And how many of our our military vets come home and either take their own lives or turn to substances, alcohol or drugs. This shouldn't be okay. They served our country for us, and it should be a thank you, not a, you know, abandonment. So regardless of, again, not to stigmatize substance use disorder, a person is a person is a person. If our communities are welcoming and friendly, no matter who they are, they're going to do better. And if they're not, if they're closed off and they abandon people, people are not going to do well. They're going to be more likely to experience disease and death.
Thank you.
Darlene, he just set the stage for my next film.
Yes.
So we're going to have to do this again when that film gets made, but
Thank you. We're getting so close to the top of the hour. This could go on. There's so much good that all of you are doing. You've raised really important information for our viewers. And in addition to that, I want to build on that idea of community. You keep talking about it starts at the community. It starts with the grassroots. It starts with opening our hearts and our minds and educating people. Maybe they've never had this information before. So this is why the film and your book, Dr. Cook, are so important for community outreach. So now we want to give our members, since we are Region 6, we have certain funding that we can promote to communities, as I mentioned before, to kickstart programming in communities. So working with Lisa, she's generously offering to help us extend the film to your community. And as we said, you can share this film in a library, in a church, in a public health department setting, anywhere. But to get the group, get the community together to see the film and discuss it. They have created a wonderful film with a discussion guide. So you can share hope in your own community with our funding. So what we have to offer is a community screening of the 45-minute educational version of the Addict's Wake, as you saw in the last week. And you can go to this email address that you see here, nnlm.gov/AW application, or snap a picture if you have your smartphone available. This will take you to an application form, and you will have until October 31st to submit an application saying, yes, we want to share this film with our community and hold a discussion around substance use disorder. Submit your application. It is competitive. We will review it, and 4 communities will be selected. So please apply. This film is fantastic. I think you understand how it can open up the discussion, open up hearts and minds. We have just a few minutes left. Are there any questions that haven't been, that people would like to ask our guests while we have them? And we did have one response in our chat box. Brandon, and I'm not sure if I'm saying your name correctly, the last name, but you are with the Indiana University School of Medicine Library, and they are a Region 6 partner organization outreach program. Thank you. They said they're interviewing peer recovery coaches for the Indiana Substance Use Disorder Oral History Project. 5 1 to 2 hour interviews were conducted or have been conducted so far, and they can be streamed online. So you can take advantage of that, and he's provided a URL in the chat box. So any questions? And if not, any final remarks from our guests, any final comments, thoughts that you would like to share?
I just would like to say regarding the film that we now have a film series that is, the first one is community based. The second one is for educational, 6th grade and on up. As I said, we have some adults using it for an educational CLE class for their lawyers in upstate New York, which blew me away because that's something I hadn't even thought of. But I love that they feel like that's appropriate to spread that education and communication. And then what's coming by 12/1 will be that law enforcement first responder piece. So now we want to be community partners, not just come in and screen one and done with your community. We want to help you reach all the stakeholders with the important messaging that Dr. Cook brings and others in the film who offer their voices to this issue. And so please go to theaddictswake.com. You can watch all the trailers for all 4 versions of the film, the editions that we have. And thanks everybody for your interest in taking a look at what we sent out over the last week.
Thank you. Dr. Cook, Dr. Whitty?
I have people ask me sometimes what can they do for their family member, because sometimes it gets painful to watch, your son, daughter, brother, mother, struggling with substance use disorder, and there's a lot of hope there when they're doing well, and a lot of despair there when they're not. And so often I've seen people, get to the point where it's so painful that they just turn their back on their loved one because they don't know what to do. How do I help? And I like to turn to the story of the prodigal son in those situations, because you have somebody that left home. The father was worried about him, didn't know what to do. He's out there struggling, but when he got to the point where he was so desperate, he had no other place to turn. He didn't feel alone. He actually remembered his father's love for him, and he came home, and his father accepted him with open arms. We have to set boundaries. We can't let certain activities to occur in our homes and that sort of thing. But people always need to know that it's safe to return home, that there are people that care about them. Because when they're having that worst day of their life and they feel alone and there's nowhere to go, that's when bad things happen. So I just encourage people to always leave the door open, always ensure that if nothing else, people know that when they're not okay, they can turn, to us for help.
It's great.
Yeah, and I that's one of the key things, and what I hope can come out of Lisa's films, and showing it to and capturing these different audiences, that it's very different depending on where you're at in the cycle. Law enforcement. I am a crisis intervention training coordinator. And I teach law enforcement. I get a totally different story from them than others. So, but teaching people that there is hope, that yes, people come out of this and they are amazing. They don't ever see that. And, or I can't say never, but the fact that they might see one and think, okay, well, one person made it. It's not that. You come to the Recovery Cafe with me and you see these amazing people who are spending their time helping themselves get better and helping others as they need more help. And so this Saturday we're having a recovery family cookout for National Recovery Month. I mean, it's just, we need to do things like that and have a community that is very welcoming. And we've invited everybody in the community, not just people in recovery. So, and I think, Lisa's films are a great way to do this.
I agree. So thank you so much. We really appreciate your time. We appreciate our members being with us today to hear their messages. Please, if you know somebody, if you or somebody you know would love to have this film in their community, please reach out. You can send questions to myself and we'll be in contact. Thank you.
Bye, everybody. Thank you.
Bye. Thank you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.